Hey, Patrick Hope, Delegate Hope, good to have you with us.
Good morning, John. Thanks for having me on.
Okay, just today when we're on the air, we got news that Minority Leader David Toscano, Democrat Charlottesville, saying he's stepping down as Minority Leader, wants to spend more time with his family. Was this something your caucus was aware of, planned on, or anything else?
Yeah, no, it's a complete surprise to get that note from David, and I know David put a lot of time and effort. You got to count me as a David Toscano fan. I think most of your listeners don't know how much tremendous sacrifice it is to first be in the General Assembly and to add the responsibility as lead Democratic leader, in addition to all your other jobs that you have to order to keep the home fires burning, your family and whatnot. It is a very difficult job. There's a lot of sacrifices that are made to it. I was surprised by, as everyone else was. I would have liked to see him continue. I think he's done a terrific job for us. But you know, it's just as you were watching Paul Ryan go through his different thought process of whether he should be Speaker or not, you do got to take consideration of having a young family. And in this case, this is actually the most difficult part, is you got to take into consideration how you're going to survive. I mean, we delegates make $17,600, and so in order to make up that difference, you got to have either be personally wealthy, or you're going to have to be able to have another job, another stream of income. And the time and the effort that it takes to be leader really limits that ability. And so hats off to David. He's always done a great job. I'd like for him to reconsider. I don't know that he will. I understand all these decisions are personal, and I support him in whatever he does.
He's a class act. He's been on our show. He's a mainstay with us. Comes on whenever we ask him. Great guy, wonderful family, good dad, good husband, and he's going to be missed. I'm happy he's still staying in the House, but you know, as Minority Leader, he had a certain way about him that I think really was effective, inspiring, and I think he'll be missed.
Yeah, no, a difficult guy to not to like. I mean, he was on both sides of the aisle, very well respected. He had a great demeanor, a great tone, and yes, his leadership will be missed. But I'm looking forward to him staying in the House.
And the other thing I'm going to miss, Delegate Hope, is he has a great sense of humor. Also, every time I got together with him, all we did at the end of the time I had with him was laugh. Guy's got a great sense of humor, and I think that's going to be missed. Yeah,
absolutely right. Absolutely right.
All right, let's get to let's get to the elephant in the room: healthcare in Virginia, hospitals in Virginia. I want to bring your attention to an editorial that was written today in the Richmond Times-Dispatch, basically ripping to pieces the Republicans' argument that this study that they sanctioned on Medicare expansion really was cementing their position. The Richmond Times-Dispatch today coming out with an editorial basically saying this study that was done actually doesn't have anything to do with the argument for Medicaid expansion. Did you have a chance to read it? And if you did, can we offer your insight on it?
No, I haven't seen it yet, but I mean, I think they probably referenced the Thomas Jefferson Institute study.
Yes,
that just came out. This is old data. This is from 2013, and if you actually look at the study that came out, it indicated nearly half of all the rural hospitals are operating in the red. And I think if you look at what's happened since 2013 to hospitals, their economic situation is even worse than what it was then. You got all these pressures for Medicaid and Medicare. I mean, I think most people don't realize this, but if you think about who is the biggest price controller, it is the government of Virginia. And, of course, the federal government as a whole. They tell you, imagine that you operate a business. Let's say you own a grocery store. Imagine the government tells you how much you can charge for eggs and bread and milk, and you can't charge any higher than that. That's what we have with Medicare reimbursement, which is about 80 or 90% on the dollar. Medicaid is 66 cents on the dollar, and you think of sequestration that we've gone through, and on top of that, the government tells you that anyone who comes into your store and they can't afford to pay any groceries, you have to give it to them for free. Hospitals are delivering so much uncompensated care. And, oh, by the way, they also have to operate an emergency room that's available 24/7 with specialists available or on call at all times. And so these are businesses. And if you look at the numbers, the profit margins, they are so thin. And with that study that came out indicates that nearly half are in the red, I would imagine 2 years later, these hospitals are struggling. I would imagine that more than half of them are operating in the red or close to the brink. And so I think that this is a conservative argument, but it's also a liberal argument as well. We have to do something to protect our rural hospitals in particular, but make sure all of our hospitals can thrive, because there's such a tremendous place for our community. The economics, the jobs that they create, the economic engine for a lot of these different communities are really the lifeblood of a lot of towns in the rural parts of the state. And we have a serious problem that the General Assembly has to address, and I hope we address it this session.
Well, I think you have to address it, Patrick, because as you just said, 50% of rural hospitals are in the red losing money. You don't lose money in perpetuity without going out of business. Nobody does that. And then somebody was telling me the other day, well, they're nonprofit. Okay, well, nonprofit doesn't mean you lose money, because what a nonprofit is you're not there to make a profit, but you have to break even. Otherwise, somebody has to fund it to make up the gap. These are not public hospitals like I grew up with in New York City, basically where the taxpayers paid for the hospital. These are private hospitals. They have to fund themselves. 50% of them right now in rural areas in Virginia, in the red, losing money, cutting services. One just closed. When you go to a hospital in Southwest Virginia that shuts down, I don't mean they stop doing 3 or 4 services. They just shut the place down. That's going to be a trend if you guys can't get to conference in 2016 and find some way to solve it. Do you have any ideas, Delegate Hope, on how this dilemma could be solved?
Well, we have to solve it. I mean, a compromise is to maybe try a pilot. I know there's been a lot of scuttlebutt about the hospitals actually asking the General Assembly to tax them, to give them the ability to assess them with a tax. And this is how desperate they've become. Imagine a business coming to the government saying, please tax us. We're willing to put up half the money if you'll draw down the other half so that we can keep our doors open. And that's really what it's come to, and that's how desperate they've become. And they've told us, look, we're willing to take on the risk. The cost of Affordable Care Act, the Obamacare, to expand it, whatever costs may incur on the state, we'll cover it. We'll take that risk. We are in that desperate straits right now. And I think we've got to start listening to our rural hospitals and come up with a Virginia solution. We need to come up with some sort of compromise. Call it whatever you want. Republicans are in charge of the House and the Senate. I think it's their responsibility to come up with some sort of compromise. And the thread the needle moment is that we need to come up with a solution, a Virginia solution, where everyone can declare victory. And I think that's going to be the real challenge, but it's a real problem that we're facing throughout our state. And Virginia has faced tougher problems before, and I hope that we come together and solve this, and we need to do it right away.
Well, you're right, Delegate Hope, and what we need is real statesmanship, real bipartisanship, and not just mouthing the words, but finding a solution for this, because you can't just keep saying no without having an alternative there. Medicaid expansion, Republicans say no. I get that. Terry McAuliffe, our governor, comes out with a provider tax plan. Immediately, first reaction, Republicans say no. Okay, I understand that. So, but you got to have an alternative, because these problems aren't going to go away. And somebody is going to have to fill the gap on these rural hospitals that are operating in the red, that are going out of business, basically, and their funding is being reduced. Only 66% of every Medicaid dollar, 66 cents out of every dollar going to them. When you look at Medicaid, every Medicaid patient that comes in, hospitals lose 10 cents on a dollar, and then you've got people that walk into the emergency room. All that is free. You're going to have to solve this.
Absolutely right. And I think, and Secretary Hazel talks a lot about this, the more people that we can cover, the cheaper it will be in the long run. I mean, you'd look at someone who has an inability to pay. They show up in the emergency room with a heart attack. We can prevent a heart attack these days. And that's a tremendous cost saving if we can prevent a heart attack. We can treat you through medications, through different imaging scans. We can make sure that your arteries are clear and you don't ever end up in the emergency room for a very expensive test. For women, a stage 4 breast cancer, we can treat a stage 4 breast cancer, but it's extremely expensive. We ought to catch these things early on at stage 0 or stage 1. It's much less expensive. And we talk a lot about the fraud, and there was a JLARC study that just came out that talked about finding $38 million of fraud in an $8 billion program, which is about 0.5% of the entire program. We need to go after that fraud and abuse. But what about the waste in our program where we're not focusing on preventive care, where the $5 million a day that Virginia taxpayers are paying to the federal government and not getting that back? That's a waste. We need to reclaim that money. We need to make sure that we can get as many people covered in a program as possible so that we can exercise preventive care. And think about the person who ends up dying of that heart attack. If we could have prevented that episode, that would give them 20 or 30 years extra with their families. I mean, these are our neighbors. These are our friends. They live in our communities. We ought to deal with that problem. So I really see this as a problem, not about Obamacare, not about expanding Medicaid, but we have people that are working Virginians that need coverage, they need health care. It's extremely expensive to care for them on the back end. So let's find a solution, a Virginia solution, that focuses on preventive care and saves taxpayer dollars. And the other issue that we've spent so much time on, and I think is just as important, if not more important, is this rural hospital issue. Don't talk about Obamacare. Don't talk about the Affordable Care Act. Let's talk about ways that we're going to solve that problem. And I think if we go into the 2016 session with that mentality, then I think that we can come up with a solution.
Well, you're running out of time. Hopefully you're going to be prophetic on this, and you will. Common Sense News Time, 8:55. We're with Patrick Hope, House of Delegates member, Democrat, 47th District. That's parts of Arlington County in Northern Virginia. Patrick, I've got 2 minutes. Medicaid expansion is a non-starter. It isn't going to happen with the Republican supermajority in the House and the majority they have in the state Senate right now. Do you guys is there an alternative to that possibly everybody could live with?
Well, I think that's what you're hearing when you talk about this provider tax. I mean, Tennessee has done this where I think the biggest complaint from Republicans comes is that they're worried about what it's going to cost the state. And I think if you talk about this provider assessment tax, you're putting hospitals, the providers, on the hook for paying whatever costs have to come out of the state government. And so I think that is a compromise I hope that people consider. You could try a pilot program. There's all different kinds, and I should add, 30 states have expanded Medicaid in their state. Many of them are Republican. They have found a way they found that sweet spot to make everyone happy on both sides, that has the proper controls and the proper levers in there to make sure that we are being responsible about this. And look, Republicans are in charge. I hand them the pen. They need to come up with a solution to solve these problems. But I think if we put our heads together, we certainly can do it, and we got to get politics out of it. The provider assessment is one way to do it that will help preserve and make sure and protect our budget. But the other way, they're talking about lifting some restrictions with a certificate of public need. I certainly would like to see some relaxation in that area, but there needs to be proper safeguards in there. If we do those things, I think that there's a way to get there, and I look forward to working together with Republicans and Democrats to solve this problem together.
All right, that's going to be the final word. We want to thank Democratic House of Delegates member Patrick Hope, 47th District, part of Arlington County, Northern Virginia.